Hello there and welcome to the Brain Forum and the first of our brain debates for 2020. It's the mental health crisis in a knowledge economy. Now I have a very esteemed panel of experts, all with a very different, a very important opinion. So kicking off, first of all, we have our chairperson. We have Dr. Paul Litchfield. Now, Dr. Paul is a British physician. He's the chair of What Works Centre for Wellbeing since 2015. He's a member of the NHS Healthy Workforce Advisory Board and is co-author of an independent review of the UK government regarding employment. Hello to you, Paul.
Hi, Anna.
And of course, you are our chair as well, so you'll be taking the floor shortly. Alastair Campbell, hello. Nice to see you, Alastair. Now, Alastair Campbell needs no introduction, I'm sure, for many of you. He's a writer, communicator and strategist, known for his role as former British Prime Minister Tony Blair's spokesman, press secretary and director of communications and strategy. Now, Alastair has played an important role in breaking down the stigma surrounding mental illness and in fighting for better services, a drum I very much beat myself. We have joining us here digitally today as well by the wonders of technology, Carmen Sandi. Hello to you, Carmen.
Hi, Anna.
Hi there. Now, Carmen is professor at the Swiss Federal Institute of Technology, Lausanne, where she's the director of the Brain Mind Institute and leads the Laboratory of Behavioural Genetics. Professor Sandi has been the president of FENS since 2018, and we welcome her today. Andrew Jack, hello, welcome.
Hello, thanks.
Nice to see you, Andrew. Andrew is Global Education Editor for the Financial Times. He oversees the annual Health at Work report, writing on educational issues around the world, and is editorial lead for the Free FT Schools programme, which is offering free access to online FT resources to more than 50,000 students across 100 countries. Which leaves me, your final panellist for today, jack of all trades in here as MC as well. My name is Anna Williamson. I'm a TV and radio broadcaster. I'm the author of several self-help books, not least the Amazon #1 bestseller, Breaking Mad, The Insider's Guide to Conquering Anxiety, which was built on my own personal experience. I'm a fierce mental health campaigner as well for leading UK mental health charity Mind, about stigmatising mental health and promoting mental health awareness, not only in the UK, but also globally. So that is the panel for today. I'm looking forward to this debate to hopefully share some insight on what is going on with mental health, the crisis that is undoubtedly unfolding within a knowledge economy. So over to you, Paul, as our chair.
Thanks very much, Anna. May you live in interesting times is said to be a Chinese curse. Well, we certainly live in interesting times as we grapple around the world with the most significant outbreak of infectious disease in certainly the last century. Coronavirus is spreading around the world. It's causing chaos. It's causing misery. Something like 8 million proven cases, over 400,000 deaths, a global recession. But I think the danger is that that pandemic blinds us to an even greater pandemic, and that's the pandemic for mental illness. And to give you some numbers there, every year, 1 billion people around the world suffer with a significant mental health problem. 800,000 people take their own lives every year. And the economic cost of mental ill health is estimated at something like $1 trillion every year. Now, if those numbers I've just spoken about were attributed to the coronavirus, it'll be the top story on the news. And yet, to find those numbers, you need to delve into an obscure page on the World Health Organization website. Those two pandemics, of course, aren't entirely separate. They're linked. What we've seen is fear of the virus, isolation caused by the control measures that various governments have put in place, mass unemployment are all having a devastating impact on mental health. Anxiety and depression have gone through the roof in a whole range of countries. Here in the UK, a study done at the beginning of lockdown showed that psychological distress in this country was equivalent to the threshold for clinical mental illness. As a country, we were having a mental breakdown.
Wow.
The greatest impact, though, because the misery hasn't been shared equally, the greatest impact has been on those people already vulnerable. The poor, the young, those living on their own. At the same time, we're living through a time that's described as the fourth industrial revolution. We have advances in science, developments in technology that are transforming our lives, and not least our lives at work. What we do, where we do it, how we do it, have all transformed enormously over the last couple of decades, and that pace of change is accelerating. Most of us these days earn our living with our mental skills rather than through our physical strength, and yet we have 1 billion people every year around the world who are suffering with a disability caused by mental illness, which means that they will just get left further and further behind. And that mental illness is often preventable, it's frequently treatable. So what's going on? How can we reduce the suffering, stimulate the economy, and develop a better society? Those are the simple questions. I'm sure the panel will give us some straightforward answers. So perhaps first to Alastair, who has spent many years at the heart of government. And I suppose my first question, Alastair, is, do people in power, and I don't just mean in the UK, I mean around the world, do you think that they get this? Do you think they see mental health and mental ill health as a priority? And if they do, what should they be doing about it?
I think that some do and most don't. I think it's been really interesting. I mean, I've been sort of locked away 23 hours a day. I've spent quite a lot of my time watching the various leaders of the world in their public pronouncements dealing with this crisis. And it's been interesting, if I can pick out two. I know you've got a connection with New Zealand. Jacinda Ardern, the Prime Minister of New Zealand, and Andrew Cuomo, the Governor of New York, they're the only two leaders who consistently, to me, have talked about mental health in relation to this pandemic. That says to me they get it, that they get that this is, regardless of the pandemic, this is a big part of their responsibility at all times. They get as well that this is going to become an even bigger part of their responsibility as the world does emerge into some sort of whatever normality is going to be. But I would say that my big fear at the moment is that having, not least with people on the panel, fought to try to get a better hearing for mental health in government, fought to get better understanding of mental health in the public eye, where I think we've made considerable progress on both, I now do fear that with the scale of challenges that governments around the world are going to face, particularly economic, coming out of this, I think mental health is going to go, there's a real risk it will go back to the bottom of the pile again. I actually sense that that's already happening in some of our governments. And I think that we've got to be very, very mindful of that. And I think with, it's hard to divorce, but given that this is the longest I've ever been stuck in Britain, if I can put it like that, so I'm obviously at the moment thinking a great deal about Britain. But I really do worry that these kind of what I would define as these right-wing populist governments, it's not that they don't get mental health. I worry actually it's going to be one of the things, a bit like climate change, that they don't want to get. They actually think it becomes part of, I hate this thing about woke, it's going to be a bit woke, whatever that means, to care about the mentally ill, to care about the impact of big events in the world upon people's psyche and psychology. And so I really do worry that is going to impact very adversely upon an area where I think we had been having progress. And I think the other worry I have is that I think one of the sort of insights that people have wanted to have out of this is it's such a big thing that something better is bound to emerge from it. Now, that may be true. It may be true. But if you look at the Spanish flu, it certainly didn't emerge out of that. And I think if you look at, I think if I had £1 for every person who said to me, God, it's so nice to hear the bird song, right? Well, fantastic. It's great to hear the bird song. We don't see the planes in the sky so much. And that you maybe think, well, okay, maybe climate change, maybe we're going to take it more seriously. On the mental health agenda, I just have a fear that the opposite is going to happen. That actually we're going to think, do you know what? There's so much else we've got to worry about. We can't worry about that too. And that is making me alarmed about the way this thing is going. Added to which, look, the pandemic has been a disaster in terms of the short term. If you think about the UK, at least 60,000 people some would have died, without a doubt. They would have died in this period anyway. But we're talking about, tens of thousands of excess deaths. Horrible phrase, but it's kind of a horrible thing that's been happening. And already, we're kind of used to it. And it's like, when you actually have cabinet ministers who say, only 200 died today.
Yeah.
I mean, you start, and they're very sad about it, and their thoughts and prayers are with everybody because, they always are. And it's just a little formula. But actually, no, we've just accepted that this is the way of the world. Now, once you've done that, once you've actually accepted as normal something that is profoundly abnormal, then you don't have to go very far to think, do you know what? It's kind of understandable that we've had a tripling or a quadrupling of people who jump in front of a train. Because that's what I worry about where the next stage is and where the economic pitch becomes so important. If you think about the economic crash of a decade or so ago, I can remember talking to Alan Milburn, who was the health minister in Tony Blair's government, an MP for the North East. And I can remember there was a period when he was saying that, he was having to organise his travel to London to come to Parliament to get here a lot earlier because it was becoming such a frequent event that the train journey was being interrupted by an incident, and you knew exactly what it was straight away. And the Royal College of Psychiatry, they've talked about there being what they call a tsunami of psychological and psychiatric distress coming out of this crisis. And if you just go through the possible areas for that, in the military situations, we talk a lot about the front line and PTSD. Well, we talk a lot about the front line in this, and there's going to be, I think, significant PTSD amongst healthcare workers and other emergency services. You talk about the impact upon, I've had a relatively nice experience in lockdown, being with a family that I like in a nice home, got lots of things to do to keep me busy and so forth. You imagine coming out of this if you've just had 2-3 months in an abusive relationship. You imagine coming out of this if you've just discovered, actually, do you know what? I'm not sure we can live together any longer. Do you know what? I don't really like my kids very much. That's all going on as well. Where is that all going to lead in terms of the psychological fallout? So I think unless we're thinking about those things now, we're not going to have the plans in place to deal with them. And I don't, I'll wrap up with this, in answer to your original question, do I imagine this is high on most governments' agenda right now? I'm afraid I don't. I don't think it's on most of their agenda at all. And it's a real worry.
Yeah, thank you, Alastair. Andrew, moving to you, just picking up from what Alastair was saying there, sometimes when governments lead a vacuum, employers will step in and do things because things aren't happening at state level. And there's no doubt that work and what happens within the workplace have a major influence on mental health. So how would you encourage employers to invest in improving the mental health of the people who work for them?
Well, first of all, I think Alastair's absolutely right that we're not necessarily going to see some sort of radical, different, transformed world as a result of COVID. But there's no doubt the intersection of the current pandemic with mental health issues is very tight and is going to grow. And we're going to see, obviously, not just the direct impacts and how that's driving working practices. But also, of course, the longer term health impacts of the economic downturn that we'll see in the wake of COVID. So I think that's going to be a huge issue as people lose their jobs, as there's greater uncertainty and insecurity. And that's something that employers are paying and will have to pay attention to. If there's any sort of positive aspect of the situation so far, it clearly has meant, I think, that a lot more employers have started to realise in the short term they have wider obligations, both morally and in terms of self-interest, in terms of productivity. Now they're dealing with the vast majority of their workforce either in furlough and struggling for contracts or working remotely from home, often in very uncomfortable circumstances. They're being forced to kind of see this acceleration of the use of technology and how it can be a force for bad, if you like, as well as a force for good. Now, what should employers do more generally? And I do think there is both a sort of wider moral case and an economic case for them to think about this. Because clearly, if you hire somebody, you identify some mental health issues or they have the courage to flag them up, there might be some sort of challenges to management, some additional resource implications around it. But clearly you don't want to simply be discarding employees who have many other talents just because they also have other parallel conditions that they need to deal with. And it is, we know and we recognise increasingly, diversity of all sorts in the workplace is actually really important in terms of being sensitive to your clients and customers, in terms of understanding and developing more innovative approaches to your products and services that you're trying to sell. So there are really many potential upsides, but of course the tension is going to be with this sort of big economic downturn that's coming, everyone will be looking to save costs. And so there could be some temptations to really, skate away from addressing the fundamental issues around prevention, identification, support with mental health. But I think the reality is that there is a strong economic case around this. I think the evidence base is still, unfortunately, not as good as it needs to be. And so we need a lot more research to really understand what the interrelationship is with productivity and motivation, how we empower employees, whatever their physical and mental states might be, and how we encourage best practices. So I think employers themselves that are already doing things need to actually question and research and share the data and the best practices that exist much more widely. And that's really a starting point to mobilize society to start to really reflect. Historically, a lot of health at work interventions superficially looked attractive and people would think about those sort of physical aspects. If you're a kind of city law firm, you might provide a gym membership or fruit in the meeting room or whatever. The sort of, obvious trimmings, if you like, that can attack, perhaps some sort of temptations for people being a little bit overweight, for example. But the reality is the really existential issues that everyone are facing are mental health related. And to me, what that means is the need to think a lot more about, if you like, empathetic, empowered management. It's about trying to establish meaning in the working life for employees. It's about understanding and flexibility. It's about empowerment and autonomy as far as possible, and flexibility in working practices. So I think those are the big areas of focus that employers need to start thinking about, and society more generally, and indeed governments, need to be supporting and facilitating.
Thanks very much. That call for better evidence, I suppose, leads naturally onto Carmen. Hi, Carmen. In terms of science and technology, as we said at the outset, those are transforming our lives. But what do you think they can offer in terms of improving mental health on a global basis?
Yes, maybe I would like to take the opportunity now to reply a little bit to what Jack was just saying, that indeed I think I agree that changing the structures and the stressors somehow, or making approaches that are more behavioral, structural at the workplace, etc., it's important, but we have to understand also how stress affects the brain and how it affects behavior by affecting the brain and cognition, of course, etc. So it's true that in many cases, these changes in structures and how the social environment and the work environment are organized and reducing uncertainties in people are going to be very important for change. But maybe this is going to be effective in those that are less affected, let's say. We have to think, we are talking about cases of PTSD, for example, and this is a disease that it's very difficult to, let's say, erase, to eliminate, because it's like an imprint of the threat situation in the brain, and the brain develops a kind of a defensive adaptation to always react cautiously and being aware of anything that brings a reminder of circumstances, etc. So what I want to say is that it's true. Maybe we have to find ways to change the structures, but I think we are very much behind on knowing how we are going to solve the current situation, because we are very much behind also in the investment that governments and foundations are capable to do at the moment in mental health research. For example, if we compare between the amount of funding that goes to cancer or to cardiovascular disease, mental health receives much less. So I'm going to maybe make the point for why we need to really make efforts in investing more in stress research and mental health research, because we are talking about stressors at the moment that were very acute and punctual at the beginning. No, like everybody was a bit shocked when the pandemic was outbreaking and when the government started closing down, etc., because the future was so uncertain, and also how the virus was going to evolve, etc. So this was quite acute and abrupt, and afterwards there were many other aspects that started falling down in terms of stressors. Like indeed at the beginning everybody also reacted much more solidarity, and I think people were very hopeful that somehow the new future was going to be better, but since everything took much longer than many people thought originally, then many other stressors start coming. And all this together is going to affect different people in different ways. And for some people, it's a bit, let's say, difficult to reverse. I don't want to say irreversible, because there is no reason to say irreversible. But what I think it's important to understand is how stress affects the brain. And I always like to talk about the stress from the point of view and the evolutionary meaning that it has. Because the physiological stress response, all that we normally feel, that is more tension and these palpitations, sweating, and many other responses that then afterwards come with more metabolic adaptations, hormonal, etc., they are very positive, and normally they've been selected throughout evolution because they help us coping with threats. So this is perfect, and normally I think there is now a mismatch between the threats that our ancestors had and the threats that we have, and that's why sometimes maybe it's not so adaptive, but being stressed and reacting stressed under threats is positive, and this allows us to adapt and cope normally. But another problem is that indeed, because stress is made to make our adaptation adaptive, somehow it has the capacity to program our brains for later. So the brains are programmed now to be very defensive, and that's why they are very fearful or very anxious, very cautious to whatever can come, etc. And that's the result of many different complex processes that are happening in the brain in terms of remodeling of the neural circuits, changes in connectivity between different brain regions, changes in neurotransmitters, etc. And this is something that it's quite complex, because the understanding the brain is already very complex. Understanding the brain behaving is complex, but understanding how factors affect all these aspects is complex. And I think we've done a lot of progress in the last decades, and that's why we know many of the elements that are affected in the brain, but we don't know enough. Also because we've tended to look at phenomena as a kind of a general type of adaptations, and what we see now is that different individuals react differently, and also the brain mechanisms are different, and we need to understand individual differences, vulnerability, resilience, etc. But anyhow, we made progress, and I guess we will talk a little bit later about what type of technologies or approaches we can be implementing. But from what we already learned, for example, just to make it a couple of examples very clear, we know now that those individuals that have undergone chronic stress or exacerbated type of stress, in many cases, what's going to be, it's a change in the balance between the excitation and inhibition of the brain. The brain is a kind of a machine that is very well balanced with excitation and inhibition. And this balance is normally broken by stress towards more excitation. This normally goes with enhanced anxiety, etc. But just, it sounds very simplistic. But in the brain to happen, we have many different circuits and cell types and also molecules that are exerting very different functions, from putting the circuits, the neurons together, to affecting more the inhibitory neurons, excitatory neurons, etc. That's why I think understanding the details and how these relate to different manifestations, behavioral manifestations, etc., it's going to be very important. Other example, I think that it's going to be very relevant in the near future is also that we are seeing that stress can affect metabolism, and not only in the body in general, but also in the brain, in the neurons, and also in the astrocytes. And this is very interesting because metabolism can affect very much brain function, how the circuits respond to challenges, because the neurons have to fire, and for that they need energy. And depending on the resources of the individual, one can imagine that it's going to be more capable of keep going and enduring, or do the opposite, and retract, etc. That's why maybe in the future, indeed, we can understanding better the alterations in metabolism or in excitation inhibition, we can develop better approaches for treatments. But from what we know already, indeed, the first clinical trials have started already with some metabolic nutritional interventions that eventually have been able to have benefit effects in depressed patients that normally were resistant to many other treatments, like several antidepressants, etc., and some nutritional approaches that tap onto metabolism were capable to be positive. And here we have a lot to do. I was happy to hear also that we think that motivation is one of the factors that is going to be affected by this pandemic, because I think probably motivation, because it's the predisposition or the function that allow us to engage ourselves in the environment is very much sensitive to nutritional interventions, probably. And the other example is indeed because we know that the brain dynamics change with the stress. We can do a personalized assessment of how different individuals are reacting to stressful situations, etc., and combine neurofeedback, which is teaching the brain to change the way it activates different oscillations and neural functions, to change the mode from more anxious to more relaxing. And this is going to be very important for those that are resistant to treatments or to changes yet at the structural level, because we need maybe sometimes to combine and understand the problems. And this is something that indeed with new technologies, probably this approach can help even boosting the effectiveness of mindfulness, that it's also very relevant nowadays. And there is the other debate also that it's going to take place about it, but maybe coupling different approaches and understanding better what's changing in the brain. And that's why I started my intervention by indicating I think we think it's going to be a pandemic, and difficult to predict how, because we don't have a lot of knowledge, and I think we should be investing much more in research for mental health.
Thanks very much indeed, Carmen. Anna, we've heard from government, and we've heard about business, and we've heard about the scientific community.
Yeah.
But certainly as a physician, I always start from people being the most important element in all of this. So how do you feel that we can support people who have got impaired mental health? How can we support them better? And in particular, in the context of work, how can we help them to get into and then retain work, to give them the dignity that comes with that?
Great word there, dignity. And I think, and I speak myself as someone that has had mental illness or managed mental illness for years, and I am someone that's proud of that label, because I think it's undoubtedly shaped my life and my career all for the better. In fact, I proudly work to destigmatise the label of mental illness, which I think historically has always carried such a negative, draconian label that means you are less capable, that it's embarrassing to talk about. And I had a very well publicised emotional breakdown in my early 20s on television, which is there any more of an exposing place to lay bare, you know, your poor mental health, which was, I'm no one special or spectacular in what I was experiencing. Probably very similar to the millions of people experiencing this pandemic. I was stressed out, I was burnt out, I was people-pleasing, I was taking on too much, and life had become overwhelming. I wasn't listening or feeling the signs, and I wasn't taking action, I wasn't reaching out. And I think I've just been sitting here listening, thinking, what can I add to this of personal experience and someone as a campaigner for mental health? I'm a coach. I deal with a lot with people through my social media following and my books, which I think I've mentioned to you chaps and ladies off camera. I'm sure someone meant as a derogatory comment when I first published my Breaking Mad Insider's Guide to Conquering Anxiety. Is they described it as someone terribly academic, as the ladybird book of anxiety. And I took that as the ultimate compliment, because there's absolutely a place for academia and for knowledge, and I have spent 15 years seeking it in order to be well and to have my own mental wellness. But when you are in the grips of a mental health crisis, and this is undoubtedly, the world is in a mental health crisis, in my opinion, you are stressed out, exhausted, too tired, you can't cognitively function properly to digest reams and reams of academia. And I wanted to convey my experiences of suffering with ill mental health as a regular person, you know, just because that's the thing. We are all normal. You know, normal is your functioning level. That is the definition of the word normal. When you are experiencing these strange times, if your functioning level is different to that, then you need help. You need to seek that and you need to recognise it. Following on from Andrew and Alastair, I thought it was really interesting about when you mentioned there about, you know, being as a leader, as a boss, being empathic and empowered leadership. I absolutely believe that this is where it starts, in tackling, even remotely tackling this mental health crisis, of which, and to echo Carmen, this second pandemic that is absolutely, we're in it. And I know that from my own experience of lived mental illness. And I refer, actually, when you were speaking, Alastair, to Boris Johnson. I mean, obviously here in the UK in particular, we're all very used to our 5 o'clock briefings on the telly. And the token gesture, the box-ticking exercise it feels still of we must approach mental illness, but we'll just mention it but not do anything about it. And I remember watching Boris Johnson several months ago now, and Professor Whitty, who obviously we've been very aware of here in the UK as a leading scientist. And it was a token gesture about, for those of you that might be experiencing mental distress at the moment. Now, I watched that as someone who has managed a mental health illness for years. And when that first appearance on the television, which many people around the world have had with their various leaders, of we are now in lockdown. As someone that has managed it through therapy and medication, I watched that TV appearance and I had a panic attack, and I felt those familiar signs of the fight or flight kick in. Because, hey, guess what happens when you're living with generalised anxiety disorder? You want to get the hell out of there. Suddenly you have your leader, it's law now to not leave the house under these circumstances. And that, for anyone living with ill mental health, and people that even haven't lived with mental illness, that evoked such a high level of anxiety. Anxiety is the #1 mental health illness or mental illness in the world. And yet I believe that we have had a complete disregard for every single human being that is either living already with mental illness through this pandemic. I am one of them. And for people that are experiencing it for the first time, the first flutterings of, you know what, this is difficult. What am I experiencing? And I watched in disbelief with my husband to hear Boris Johnson and Professor Whitty, and I'm not slamming them, but they, in my opinion, did a complete disservice to the millions of people watching, asking for help or needing to that signposting. And it was, I watched it ping pong between the two of them, not really sure what the answer was, and I'm sure you'll appreciate this, Alastair, some box ticking exercise of ring the Samaritans or ring Minds charity, of which are completely overwhelmed and under-resourced and under-financed at this time with the amount of people that need them. And that, for me, spoke volumes in that you haven't even considered that this is going to be an issue, that it's already an issue, that it's going to become more of an issue. And then you throw into that, as the weeks have evolved, and I speak for every normal person out there, I've had quite a good lockdown, like you were saying. You know, however, I'm a representative of a lot of people that have had to suddenly take on 5 jobs in a day, overnight. You got no warning for it, and that's unfortunate. That's just the way a pandemic works. But suddenly overnight, everything I knew changed like everybody else. My childcare was taken away. My children have 2 working parents. I have 2. My parents, my support network was ripped away. We didn't have a physical support network, which so many rely on. I suddenly had to homeschool. I suddenly had to hang on to my job. Incidentally, like a lot of other people, my entire job in broadcasting flatlined immediately. Overnight, my 6 months of work went. I'm a freelancer, hand to mouth. My income completely went to the floor. I was worried about my vulnerable family members. So I think speaking for sort of the common Tommy, so to speak, overnight, this pandemic has evoked so much overwhelm and exploited so much vulnerability that there are 2 things, really, of people that are already, like myself, living with mental or managing mental illness. Again, that's the other thing. Suddenly, with all of your resources having to change, I couldn't see my doctor. Waiting lists suddenly increased. You know, what if my medication ran out? Are the pharmacies open? Can I get to my pharmacy? Oh, no, that one's changing into a COVID unit. All of these uncertain questions. So resources were suddenly changing for everybody. So living through it myself and having to very carefully manage my own mental health during the pandemic, which fortunately I've been able to do, but my God, I've been tested more than anything with these multiple skill sets I've had to suddenly acquire overnight, the uncertainty, the vulnerability. There are millions of people already struggling. Throw into that relationships. Domestic abuse is also another area that's been, chalked up quite rightly by the government. Relationships, parenting. I mean, I've lived all of these, not the domestic abuse, I'd like to hastily point out. But we're living through a lot. And I think the overwhelming response that I have had with the job that I do and on my social media in particular is my thing, really, and reaching out to just everybody, is this common notion that everybody is scared. And when we have all of our foundations ripped away, which everybody has, everyone has their own story, everyone in this world, it's the one thing we all have in common now. We are all living through this global pandemic. But I think there is a huge disservice already that's been done to supporting mental health. And I sadly absolutely anticipate that this will be the pandemic, the mental health fallout over the next few years, and the uncertainty and bringing it back to the economy and bringing it back to workplace. Bosses don't know what to do. Employees don't know what to do. And I believe very much that putting in that effort and that emphasis and that importance on the leadership, because you have to lead from the top. If you lead from the top, it will filter down. So that is where the understanding and the empathy has to come in. But it starts right at the top. And in my opinion, it has to start with our Prime Minister and it has to start with the government. And they have to lead with that example.
Well, you've got a long way on that one.
Well, exactly. But without recognising the importance of that, I think it's going to be a very, very, very big challenge.
And I think you make some very powerful points there, Anna, and I think many people would agree with you about the wave of mental health. And I think you referred to the Royal College of Psychiatrists describing it as a tsunami that is going to hit us. As someone who 35 years ago found that one could have meetings about mental health, and particularly mental health in the workplace, and comfortably house them in a telephone box because so few people were interested. It's been interesting to see how over that time interest has increased very substantially. My worry has always been that it will become fashionable, then it will become unfashionable. But just picking up Alastair's point, which I think is a slight slant on that there is a danger it becomes considered woke. So how do those of us who care about the issue, who see the importance of the issue, how do we get across that this isn't some sort of celeb issue that everybody's jumping on the bandwagon? It's actually something of huge importance for our society and for our economy. How do we do that? And I look very much to those who have a experience of working in the media to, well, you all do, to how you can explain that to people and get that message across. I don't know the answer.
I mean, I think you've got to have an alliance between. I mean, Andrew talked about the employers having to see a kind of economic benefit, and I think if you're talking about governments of the right, which is they're in the ascendant at the moment, then you're not necessarily going to win them over by saying touchy-feely stuff about let's love the children and let's all be nice to each other. That's not kind of where they are psychologically. It's not where they are politically. But you will get them over if you can persuade them that actually this is the best way to drive innovation, to drive progress, to make profits, to maximise the potential that you have. And I think you've got to build that alliance between people in business who I think increasingly they do get that, and those who, like Anna and I, just want there to be better services for people who aren't very well. Okay. And I think the other thing that I think has been interesting in this pandemic, I mean, I have a sort of very odd peripatetic lifestyle where I work with different organisations, but the one organisation where I have a fairly regular, I go to the office fairly regularly, is a place where there are about 250 people. And I've noticed, for example, that they've adapted incredibly quickly in terms of, we don't have an office anymore. Well, we've got an office, but it's empty. We're all working at home. I've been amazed at how quickly they've adapted to that. But the other thing that's really interested me is that young people, kind of 30 and under, who used to go on the whole time about, why can't we do more flexible working? Why can't we work at home? Why do we have to have this kind of 9 to 5 thing? They've become much more, God, I wish we went to the office more. And the older people have become much more, this is really good. I really like this thing of being able to work at home. Now, what that says to me is that there is an acceptance across the board for the reality of a much more flexible approach to the workplace. And I think that what Andrew was talking about in relation to how employers now should look at their employees, I think we've got to educate them to look at them as assets of different value, of different skill sets, of different approach, but they're all potential assets. How do you get the best out of those assets unless you actually properly take care of the single most important thing within that asset, which is their brain and what goes on in their head and their motivation and their desire and their belief in the organisation. And I think the one thing I do see coming out of this is at least the possibility within all that churn in the employment market, as in, within that churn, how do we kind of get this into that the really smart ones think, do you know what, we haven't thought about this before. Now, if we really get to the front of the queue and thinking about this, we've got an advantage. So I think that's how you do it. You don't do it by, we carry on doing the campaigning, right? But we don't win those people over by that. We win them over by actually saying, do you know what, you guys have missed a trick here.
Yeah, I think there's a sort of an above and a below, if you like. I mean, from below, as Alastair says, clearly employees are assets. Employers are not simply, sucked into some sort of Twitter sphere abstract debate. I mean, they see the realities on the ground and they realise the need for flexible working and adaptation of their staff to continue to operate their businesses. Then the top is actually senior business leaders bearing witness, if you like. And we've had, happily, some still fairly small number of examples, but of senior chief executives and leading executives who themselves have come out publicly to say they have had mental health issues. Sometimes they've stepped back from their leadership roles, sometimes they've continued. And I think that's, we've seen it at HSBC, we've seen a number of different employers in elsewhere in mainland Europe and so on, in the US. And I think that is a very powerful message to their own staff first and foremost, but also to their peers elsewhere, that this is something that you, as you were saying, you manage and you work with, rather than in some way kind of stigmatizing, hiding, working against. My fear is that obviously in this great period of economic uncertainty that we're going into, we really have to find that right balance. So, anybody who's a bit difficult, requires a bit more resource, could be vulnerable, and whether it's their employer or whether it's they themselves, to avoid the threat of, being downsized or whatever, they try to kind of, bury those issues, and that'll really create a sort of time bomb for the future if we're not careful.
But it is about that open communication and making it just the general language. And you mentioned HSBC. I mean, we were talking about that earlier. I mean, years ago, they've absolutely trailblazed it. It was one of my first corporate speaking events, actually, within that wellbeing sector. And I think, to add as well what you were saying, I think you're absolutely right, because, everyone goes, oh, yeah. Some people just aren't into the whole feelings side of things. So you have to choose a different tack. And showing that vulnerability and letting it feed down, I think, is absolutely important, and allowing people, just letting people know that they are human and that they matter, and not treating everybody exactly the same, and just seeing everybody's individual self-worth. I really do believe in, and showing that evidence where it has worked, where companies that have got on board with it have seen that greater retention in their employees. They have seen happier employees. They have worked with the flexible working because they've seen it work better. They have listened back to what people need in a non-judgmental way, but essentially them as the employers, they're getting what they need because they are getting I speak for myself, I have never been more proactive in my work or a better employee since having a mental breakdown, managing it, learning how to manage it, and having very empathetic employers, because I go above and beyond, because I know myself. And I think that is the important. I think I'm kind of the poster girl for it, really, to show that it isn't a weakness, it's the complete opposite. I go above and beyond, and I'm far more learned, and I'm a far more, I'm a much better employee as a result of it. But it's having that leadership from the top, accepting that it's okay, and letting that language filter down, but equally, as you say, treating people as an asset and going, right, how can I get the best out of this person? What do they need? Of course, that has challenges. How are you going to do that when you have several thousand employees? Well, that is the challenge. Work out how you can do that and how you can filter that down and retain that workforce.
Yeah. So what we're talking about, we haven't used the term, is good work. And flexibility is an important component in good work. And of course, flexibility isn't just about location, it's about a whole range of other things, the time that you put in, or a whole host of other things. But just thinking about the location element, it was, as you were talking, it was going through my mind that we brought people in from home working into a factory environment at the start of the first, maybe it was the second industrial revolution. We transposed that model into office working because it was perceived as being more efficient. We now have the technology to disaggregate it again, but that carries its downside, as well as Alastair was referring to. And I do just wonder if we need to redefine the purpose of the workplace. And I don't know what people think about that in the context of people who are an awful lot younger than me, which all of you are, of course. Then how do we redefine that concept of what the workplace is for? Because I don't think anymore it's to have people close to a machine that they can operate because you can't have the machinery elsewhere. It's not because you need them all in a confined space. I mean, you get people together for other reasons, but I don't think we've really thought that through properly, and I don't think we've developed the science or made the case. But I don't know what others think.
Well, it obviously depends on the nature of work. There are some things that you really do need physical contact, and I think most people crave it, at least for some of their time, you know, whether it's for formal team meetings or things that are done.
Important.
Yeah, which is very
highly
important, exactly.
To still do.
Yes, I think that's right. And then, you know, and then of course all of that informal social contact in the corridor, in the cafe and so on, that's very important for, you know, self-worth, for motivation, for friendship, for building those informal bonds, as well as for kind of developing ideas that could be useful in your workplace. I mean, you're right. I mean, one of the dangers and the sort of the joke at the moment, of course, with technology allowing remote working is that people say, you know, it's not working from home, it's sleeping in the office, because basically you can, and people increasingly are, working round the clock. You know, the emails are coming in, you work in some sort of multinational context where, you know, Hong Kong's waking up as, you know, wherever the East Coast is going to bed. And so I think we need a lot of new self-discipline. We need lots of new working practices and reflections, really, about how to structure it. And it does come back, I think, as far as possible, and this may seem a bit of a luxury. It's much more of a sort of service industry thing, but about the idea, again, of self-empowerment, trust, flexibility. So the move away from the industrial era, the clocking in time, you know, the lack of confidence in your staff to do what they need to do unless you've got a supervisor breathing over their shoulder, towards understanding that if people are liberated, they can actually be much more productive as well as satisfied.
I mean, sorry, I think Carmen wanted to come in.
Carmen, please.
Yeah, maybe a little note here, because indeed I think it's challenging, because you're thinking of a certain type of people and workers that are very busy with international connections, etc. But there are many other also positions that maybe are more, let's say, routinary, repetitive, etc. And I think there it's a bit tricky, because maybe now we have this experiment, which is a short-term experiment, and people are happy to work, etc. But I think there is the danger that the motivation goes down. And this reminded me some experiments that we've been doing in my laboratory, in which we looked at how much effort people would be putting to earn money. It was just the same, but whether they were doing the effort and the task on their own or in competition with somebody else. Of course, we can still implement competition even if people work at a distance, but still I think we could see very clearly that those that were working in competition were capable of exerting further effort, even if it was for their own good in both cases. And that's why I think, again, everything that we are discussing, I think goes back to also understanding how stress can affect behavior cognition, but also work output. And we know that no stress, if we get very kind of comfortable at home, of course, if we are very busy CEOs or whatever, that's never going to happen. But for many other positions, in fact, if it's maybe less stressful on its own, like the work they have to do, and then if everything is too calm, we know that performance and motivation goes down, and a little bit of stress is good. And what is very bad is to have too much stress. So that's why, listening to you, I can see that indeed changing the structure, when the stress levels are very high, the anxiety is very high, it's very good to allow flexibility so that we allow them plasticity and the brain can be more open for a change, even when there is some mental health. Probably we need in those that are at the extreme further approaches and interventions, but for the general population, that could be one way to go. But I was fearing a little bit. I think, we need to learn a lot in the next months of what works for whom and also for what environments. But completely eliminating stress, I wanted to say, it's really not good at all also for performance, and also I think eventually for well-being. So that's maybe the way I see that, we will need to see indeed what works and get some evidence-based comparisons to be able to take conclusions, because the different jobs and different people also, and this is very important. I think it's important to talk about different vulnerabilities also, and different flexibilities depending on age, depending on sex or gender, or also depending on positions, intellectual type of work, etc. So I think, we know very little of how to combine this new kind of hybrid approaches to work. But I agree with you, but I was thinking while listening to your proposal that also a lot of flexibility, it's very stressful to some people. When people have a lot of choices, somehow it's stressful. We have to know that for many people, it's easier just to follow somehow, and having to take everyday decisions, should I work at home or not, might eventually be an issue. So even if I think it's a good approach, but we will have to see indeed what works for what. And I think it's exciting times ahead.
I was meant to have a book out this month, and it's been postponed to September for obvious reasons. And it's about depression. And therefore, the publisher asked me to do this thing, which I've been doing for the last few days, of interviewing different people about how their mental health has been in lockdown. And almost without exception, most of you would know all of them. They're all quite well-known people in sport and politics and business and culture and different walks of life. And most of them, because it's the easiest way to do it, is just to phone up a mate and say, do you fancy doing this for 10 minutes? Are people that I know. And what's been really interesting is almost without exception, they have reacted very differently to how I thought they would. So the ones that I thought were going to be, I'm so chilled, I've loved it, I've really hated it. Right. And the ones that I thought were going to be, I can't cope with this, I've got to be busy, I've got to be out there doing stuff, have actually just sort of loved it.
Yeah.
And it's just, I think, like I said, almost without exception, they've been counted. Now, what that says to me in response to what Carmen was saying earlier, I think there's a real danger in this, that we're going to kind of race through the moment. The big focus is going to be on the economy, whether we like it or not. And there's, for good reason, in that if the world economy goes kaput, we're going to live with the consequences for a long, long time. But I think there's a real danger we get through this without actually genuinely taking stock in anything other than a kind of anecdotal sort of way, which is the worst way of making policy and shaping arguments for the future. So I think actually having some sort of, really significant analysis of the impact this is having on people's working patterns, on their sleeping patterns, on their relationships. Yeah. I think there's an awful lot that we should be mining right now.
Absolutely.
That I suspect we're not, because the other thing that Carmen knows better than anybody is that within the research world, just as within the healthcare system, mental health tends to be at the bottom of the pile. It's a lot harder to get research money for mental health than it is for cancer and children's diseases and so forth. And so we're going to, back to the point I made at the start, we're going to go back to the bottom of the pile when actually the need should be to get to the top of the pile.
Yeah, yeah. How much of that do you think is the way that we use language? So we talk about mental health. Almost always, in my experience, that conversation then shifts very rapidly into talking about mental illness, which then often moves very fast into treatment services and lack of funding, usually, for treatment services. So how do we pull things back to get people talking about sport is a good example. A few years ago, sport for all became the slogan. How do we get to a position where we're talking about mental health for all, which isn't just about having more money going into mental health services in the NHS?
Well, I was struck by what, I'll try and hold back on the full extent of my loathing of Boris Johnson in this answer. But I was struck by what Anna was saying earlier. And part of the thinking behind this book that I've written about depression is actually for me to have reached a point of thinking, I think for a while I'm going to have to give up imagining the government is going to get this. I'm going to have to give up thinking the government is the place to go to get all the answers to this. I'm actually going to think about this for myself and those people close to me. And so it's actually about, and it's interesting hearing Carmen talking about the neurotransmitting. I went to see Roland Zahn at UCL, and I did his neurofeedback stuff, which was really, really interesting. But so now not everybody can go and spend half an hour every day in an MRI machine. So I'm not suggesting that's the way I'm going to go. But in terms of things like sport, diet, exercise, what you actually do for your own well-being, how you do that with other people, what sort of how you can shape your own landscape for this. I'm afraid, I wish it wasn't so, but I think that is where we're going to have to go. And I then think that you reach a point where actually the most important people in that, apart from yourself, is going to be an employer, not a government. Governments are going to be spending the next few years dealing with the economic fallout of this, trying to rebuild basic public services, trying to innovate, trying to sort of tackle all the other challenges of climate change, etc. We are going to have to look after ourselves an awful lot better than we have up till now. And that, I think, is going to be about family and about workplace.
Yeah.
Yeah, I was going to say, I think you're absolutely right. Language is really important. I think it's about normalization, management, as you say, kind of pulling back from illness to talk about well-being and wellness, and sharing the responsibility. Because, obviously most people spend a lot more time at work than they do, for example, in a hospital or a GP, happily. We have to shift back from thinking about treatment and medical solutions to thinking about prevention, intervention, support in the wider world. One, because the health system, heaven knows, can't cope and won't be able to cope otherwise, but also because we all have that broader responsibility. So it's thinking about it much more holistically, I think, is the key.
Completely. I have to write things down, baby brain. I was saying, looking at it and normalising it in a less catastrophic way. Oh my God, mental health, suddenly we're all self-diagnosing, Dr. Google, we're all labelling. It's just normalising it, as you say. And I was going to say exactly the same as you, it's about wellness. And just how can we be the most well and bringing it back to yourself. And I'm with you, Alastair, self-care and the care around you and trying to get those that are closest to you and most important in your life, i.e. employers, employees, to get them to dance to your tune as well, really, and to try and understand and educate. We're talking this word of self-educating in all areas, aren't we, at the moment? It's about educating ourselves as best we possibly can, because the upshot is basically it's much better for everybody else. Time is beating us, Paul. Can you believe this?
Never.
Do you have anything that you would like to add by way of summary on concluding this quite very interesting debate?
So, without appearing like a Jonah, perhaps just a warning. So, leading on from that last series of interventions, that can lead you to a position where you go hell for the leather to promote resilience in your employees. And resilience can be an excuse for creating bad work and loading unacceptable pressures on the people working for you. So I've given you the resilience training. You therefore should be able to cope with all this, whatever one chooses to call it. I'm trying to think of a polite word and I can't, that I load upon you. So I think that is a risk, and that we have to all the time balance what the individual can do, which is very important, and employers can facilitate that, but also to counterbalance it with the creation of good, meaningful, purposeful work where people are paid a decent wage, where people work in decent conditions. All of those things are as important as the personal side. And I think if one can persuade employers to do those two things at the same time, then they will start to see the benefits in business terms, which aren't just about cost control. We focus too much on controlling costs. For businesses, it's about growing the top line as well as managing the bottom line. It's about having a workforce that's more creative, more productive, a workforce that's more skilled at selling things. You boost sales, you boost revenue, as well as controlling costs. So a little bit of a warning, but also perhaps a bit of a framework for how businesses might take things
Can I
forward.
just throw something in on that, though?
Go for it.
As you were saying that, and I was thinking, God, this is a really Western discussion.
Yeah.
Because I watched Channel 4 News last night, and there was an extraordinary report about this company in Malaysia called Top Glove, which is currently making an absolute fortune around the world because they're one of the world's biggest manufacturers of the gloves that all the camera guys are wearing.
All right.
And of course, they're a big part of PPE, etc. And the report was an expose of the working practices there, which were horrific. So I think that, you know, we're talking here about where we want to get to from a very bad place to a better place. And yet our world is so far ahead of where other parts of the world are.
Just a final thought on that, sorry, but I mean, yes, so a reminder of the carrot and the stick of governments that, you know, hopefully at least in a more enlightened way, one regulating for minimum standards, but the other thing is at zero or minimal cost, whether it's just bringing heads together, facilitating coordination on best practices, as we've discussed, or whether it's things like tax breaks for employers who do provide interventions around physical and mental health, I think is fundamental and could be something that wouldn't really cost much and would deliver very important long-term returns.
Well, I'm sure you'll agree. Thank you very much to everybody that has taken part. Carmen, thank you for joining us virtually. Paul, thank you so much for chairing there. Andrew and Alastair, we do hope that you have enjoyed this. The mental health crisis in a knowledge economy. Do we agree that we have a mental health crisis? Very much? Well,
well, my definition of a crisis
go on.
is something that overwhelms you unless you take the right decisions.
Well, I think that's the perfect ending.
Decisions are still to be taken.
Absolutely. So employers, they can do more. It's not just because it's a box-ticking exercise. I think we've just touched on the fact that everybody wins as a result of that. We would love to have your input. You can find out more if you head to thebrainforum.org, but from us and from this terrific panel for now, thank you.